Okay, everybody, I got 6 o'clock, but I'm going to give it just another minute because there's a UPS truck that's about to drive away from my cul-de-sac. And I think it'll be easier if I give it just a minute so you don't hear that in the background. Okay, we're ready to get started. Thank you, everyone, for joining us. My name is Brian Dowd from the Department of Community Health. I want to go over a few technical housekeeping issues to start. The first issue, you wouldn't be able to hear me if you didn't know, but we'll handle that via Q&A if anybody says that they can't hear us. If you do get bumped from the meeting, just log back in. That usually is some sort of network connection issue, and you can get right back in. There is also a dial-in number in the calendar invitation if you can't sign in via WebEx. And always remember that all of our presentations associated with EVV, along with the PowerPoint slides, are kept on our EVV webpage. So although we're doing one of these tonight at 6 o'clock in the evening, we're also doing another one on Friday at 1, I want to say. It's noon or 1. And we will be putting both of those presentations recorded on our websites. All of our EVV town halls are there. Lastly, please submit your questions in the Q&A and submit to everyone, not just host, unless there's something you really don't want everybody to see. But we ask that you not send us any PHI. Don't send us anything that could possibly be PHI related. If you need to do that, you can use the specific EVV mailbox that I'll go over later that is specific to the Department of Community Health, and it's a secure email. It's just better that you submit anything with PHI to that mailbox. All right, so I'm going to get started with today's public forums. I am the Deputy Executive Director of Medical Assistance Plans over policy, operations, and compliance. I am joined today by some individuals from TELUS, as well as folks from DBHDD. I'm going to be doing most of the talking, and I'll call those guys in if there are specific questions they need to help us with on today's presentation. And I really appreciate all of them being there. So we always start all of our presentations with the mission of the Georgia Department of Community Health, which is to provide Georgians with access to affordable quality health care through effective planning, purchasing, and oversight. So what are we going to go over today? We're going to do just a real general self-directed waiver overview and some reminders. I think a lot of this is going to be very, very basic to you all. And you may even say, well, why are they going over this? Well, we're just really trying to re-represent what the state does as far as it does for self-directed or participant-directed services. Then we're going to give you an EVV quick reminder and updates. Then we're going to talk specifically about EVV's impact to self-direction. And then we'll open it up at the end to some Q&A. Anything that we can't answer via Q&A, we will specifically put out to you individually who sent in the question if we have your individual email, which we should from registration, or you can again submit to that email box. So we're going to start with a little self-directed waiver overview and reminders. I think everyone on the call knows what is self-direction. This has got animation in it. That's going to be a problem. Sorry. But it is a way to take charge of your waiver services and deciding who is going to be your employees and who is going to be the vendors you use for supplies. You must have a capable representative or employer associated with self-direction. Hold on one second. I'm gonna have to do this a little different, y'all. I'm sorry. Hold on one second for me, and I apologize. Did a run through of this, and apparently there is animation on this, which I don't know how that happened, but it did. So I'm going to try and pause this in between and see if it'll pause. So what was on the previous slide was just what were the services that we allow self-direction in. So we allow self-direction in several of our waivers, all of our home and community-based waivers now in COMP, the Independent Care Waiver Program, as well as the Elderly and Disabled Waiver Program that is comprised of both the Source Program and the Community Care Services Provider Program. Now, there's a lot more services in now in COMP that can be participant directed or consumer directed than there are in the Elderly and Disabled Waiver or ICWP. But as it pertains to EVV, personal support services are available in all of the waivers or community living supports in order to be self-directed. Now, you may be asking, I said earlier that you had to have a representative. So this is something we go over in our training. These are the individuals that are allowed to be a representative for a member or a participant when we are self-directing. They have to be an individual designated by the individual. They have to be unpaid. They have to be capable of completing the duties and responsibilities for participant direction. As you guys know, there's a lot of things you have to do with that, like scheduling and hiring. You may not be paid, which we said. You need to attend all of the trainings that the department or DBHDD asks you to attend and sign a memorandum of understanding. And you also have to be involved and sign the plan of care process. You can do it this way. The eligibility criteria for being a self-directed member, it's really giving me some problems. I do apologize, y'all. So let's see if I can't do this. And then resume. Previous. So you need to be able to meet the annual level of care. You have to be enrolled in a waiver program, follow the policies and procedures, understand the enrollment criteria. All those things are important points. I'm going to ask Lee Clovis, can you see the most common self-direction policy violation slides right now?
I see most common. The
Thank
first
you.
one is funds.
Okay, so I know how to, okay, that's great. What I'll do, just so everybody on the call understands, is I will go forward. Lois, if you can mute yourself again, because I'm getting background. So I'll go forward and pause the slide, and otherwise I won't have to take us all the way out to get rid of the animation. And again, I do apologize for that, but I can manage it this way so we both stay on the same page. So what we want to talk about now is kind of some of the things we've seen in self-direction for policy violations. And you guys know that I'm pretty straightforward with the way that I talk to you all about the different programs, and I try and be as transparent as possible. So I want to let you know that during this process of EVV, I've gotten several questions from members, family members and members about self-direction and how it's going to interact with EVV. And a lot of the questions have given me pause. So I want to make sure that we go over some of the common self-direction policy violations, because I want us all to kind of be on the same page when we move forward. I don't want And I've never presented EVV as any sort of gotcha, but I want to make sure that we know the policy. So the first bullet point we have here is kind of mismanagement of funds, or what I think of as inappropriate service billing, which is the second bullet as well. So I'm going to tell you a real story that I heard recently. Not a real story, a real conversation I had with someone. And I'm going to remove anything that would let you know who the person was. Of course, I won't say anything about names or what part of the state or even genders, to make sure that, there's no way you know who I'm talking about. But I did have a family member who was the representative contact me and say that, and this was a while back, that how are they going to bill for flex time? And that's the term they use. And I said, well, I'm not familiar with flex time. Can you please tell me what flex time is? Because, I learn something new every day. I thought maybe there was something I just wasn't aware of. And this member went on to explain that their family member goes to a group setting, a day group setting, several times during the week. And the aide picks them up at the group setting. And I said, well, nothing's wrong there. That makes perfect sense. And they said on the way home, the aide and the member, the actual participant, always stop and get a little something to eat, because it's just kind of the tradition, no matter how many times a week it was. And I was like, I actually was writing back and forth an email and said, so explain to me what the flex time is. And the family member said, flex time is on those days when the member gets picked up, we bill for an extra hour. And we bill for that extra hour to help the aide pay for gas, and so that they can pay for the snack that they get on the way home from the group setting. I've been asked this question, and I went back and looked today, almost 20 times over the last 3 or 4 months in different ways. I've been asked about flex time. I've been asked about travel time. I've been asked about extra time. I've been asked about billing according to the schedule. So as it pertains to Medicaid and the waivered services, we start paying when the service begins, and only when the service begins. And we stop paying when the service ends. And that's associated with EVV as well, right? So we pay when there's a clock in, and we stop paying when there's a clock out. And that's the way that you pay. And this goes to another one of the bullets here. The fourth bullet here says lack of staffing or documentation for 3 or more months. I would say for any period in which service was rendered, there should be documentation of what the services is that were rendered. If you're billing for hours outside of a time when services are rendered, I don't know how you would document that. I don't know how you would document that the service is being done for an extra hour. And I can tell you, in an audit capacity from the federal government, they would want their money back. If it gets referred to the Medicaid Fraud Control Unit, they would consider that to be fraud. No doubt about it. Now, in almost every one of my emails that I've gotten from this in the last several months related to this topic, the same thing has come up over and over again, where the family member was advised that this was okay. So one of the things we're going to be doing in the next couple of months with ourselves and DBHDD is reinforcing what is proper documentation and billing in the self-directed program. Because I don't want anybody to get in trouble. I never meant, or I don't think the department ever meant, not me, I'm insignificant, but the department never meant for this to be a gotcha moment. But it is going to show what it's going to show. So I want to make sure that everybody is aware that what happens with self-direction is according to the policy. So let's go through the rest of the stuff. You do have to be involved with your support coordination or case management or care coordination. You need to be careful if you are using DBHDD state-funded services, that those are appropriate. And that we also need to keep track of our family hires. I know right now during the public health emergency, we are allowing for billing during hospitalizations, which is the third bullet. And we all are also are doing some family hiring in some of the waiver programs still to this day. But you have to have family hires approved in this state to deliver specifically CLS. So it's really important that for those purposes, you go through and get that, because otherwise it's a violation of your terms and conditions of being on self-direction. Okay, let's move on to the next slide. So these are the quick reminders and updates. That won't go forward when I want it to go forward. So I want to remind folks that, because I get asked this question a lot still, what are the services for which we are doing EVV4, the electronic visits verification? These are the services: community living supports, self-directed or consumer-directed community living supports, personal supports, consumer-directed personal supports, and personal support services also in the GAP waiver, which is our Georgia pediatric program for children. I want to re-emphasize that these are the only services that are covered by EVV. So community access group or adult day health is not covered here. Community access individual is not covered by EVV. Alternate living services or community residential alternative is not covered by EVV. But CLS is and PSS is. I sometimes get the question about structured family caregiving that exists in our elderly and disabled waiver. That is not covered by EVV. I have spoken to many, many states in the last 2 weeks. I don't even know how many states. And I can tell you that all about EVV, that a lot of states are expanding their EVV systems now that it's been up and running a little bit to cover new services. But in Georgia, at this point, we are only utilizing EVV for community living supports and personal support services. So let's go over the timeline, because this is really important for you guys. EVV is on schedule. We will be up and running as of April 1st. We are in conversations with all of the fiscal intermediaries. We're setting up bi-weekly meetings with them in order to get our integration going with all of the fiscal intermediaries. We haven't agreed upon attestation, or what we've called in other meetings as a contract with Acumen. I know that has been a question that has been asked probably 10, 15 times in town hall meetings. Like, are you working with Acumen? Do you have a signed contract? As of our last town hall meeting, we did not. But as of this moment, from a couple of weeks ago, we got an agreement and we're moving forward with the testing and implementation phase of getting DCI, their system, to speak to our system, which is the TELUS system. So provider training is happening right now. Multiple trainings for providers are happening right now. Provider registration will be available on March 29th, and the system will be ready April 1st, 2021, which means the initial training for traditional providers will be complete, and we will have ongoing support provided. For you guys in participant directed, you do not need to worry about that right now, because we are going to be using your system, the fiscal intermediary system, to integrate with our system. So we'll be working with you between April 1st and July, which is our recruitment campaign, system refined it, and mandatory EVV for claims processing period. We're going to be working with you between this April and July point, the next 3 months, to get the fiscal intermediaries on board, you guys trained for any changes that you need to do through the fiscal intermediary, and for you to connect to our system with TELUS. So you don't need to worry about the registration on the 29th or the provider training that is on the 16th. That's not something you should really be focusing on right now. Okay, so let me briefly go through this again too. For those of you who don't know, here are all of our resources. As I said at the beginning, everything is publicly available. So we have a website. Every single thing that we do is put on the website. Fully 100% transparent and open communication at all times with EVV. You don't have to worry about writing down this website. Just go to Google and put in EVV DCH or EVV Georgia. And this website will be the first thing that comes up. If it's not the first thing that comes up, it'll be the second thing that comes up. Because sometimes some vendors get really clever and buy an ad space above that tagline because they know so many people are going to it. But the last time I checked, which was just a couple of days ago, any of those things Google, DCH, EVV, Georgia EVV, and this popped up in either the first or second position. This email address, evv.medicaid@dch.ga.gov, that goes directly to the Department of Community Health, and we answer every single question that comes in. I know because I do most of it. And so every single question that comes in, we respond to. We respond to well over 1,500 emails since that email has come up. All the PowerPoint presentations are on the website. We have tons of flyers and announcements. We are doing member and provider readiness surveys. We're going to do another provider readiness survey in a few weeks. We have frequently asked questions for providers and members and third parties. We have multiple town hall materials and recordings. All of them are available. And we also have even more information on there that you will see that we don't have listed here. So let's talk about the impacts to self-direction. What is changing? So we are going to require the use of EVV and capturing EVV required data. That is a federal mandate. Time and tracking via mobile application, that means time and tracking via a mobile application as opposed to paper timesheets. One of my learnings through this process was how much paper timesheets were still being used in the participant and self-direction world. That's fine. That's what we've used in the past. But as it relates to EVV, we do have to have electronic capture of the data. Now, many of you all have asked about cell phones. There's been lots of questions about, well, are you tracking me through the day? No, no one is tracking you during the day. The location is captured on a cell phone at check-in and check-out only. The state does not have the money or the bandwidth or the staff to track you throughout the day. Nobody's doing that here, and it would be an unbelievable amount of time and data. Some of y'all have said, well, what if I turn off my location after I check in? I don't care. Nobody here cares because we're only tracking at check-in and check-out on the phone. Other folks have asked and said, my aides don't have a phone. Well, we're going to have an exception process for the use of a phone line in somebody's house or a fixed device in the instances where your aide doesn't have a cell phone. Now, you lose a lot of functionality with that. You lose a lot of things that you can't do with a cell phone, like you got to check in from home, right? Because your phone that's connected to your house, you can't check into from the park. So, and a fixed device has to be fixed in your home setting. So you will definitely lose some functionality with that arrangement, but it will be an option that we will individually approve, and we'll have a form on the website here in the next few weeks where you can request the use of a phone line or a fixed device in the event that your aide does not have a phone that they can use. It's not changing. The waiver rules and criteria associated with EVV don't change because of EVV. Where you receive services don't change because of EVV. We are not saying you are bound to be at home. You will need to check in and check out if you have a phone, and you're using IVR or the fixed phone in your home, or you're using a fixed device. You will need to sign in from home then. But if you are using the cell phone application for your workers, and nothing is, you can check in and check out from anywhere. How much you're paying, the payment structure doesn't change, and your fiscal intermediary doesn't change unless, of course, you decide to change your fiscal intermediary. Those rules always stay the same. So what about your fiscal intermediary? We've already talked about the fiscal intermediaries. We have ongoing conversations with all of them, bi-weekly meetings that we've set up with Acumen, Continuum, and Public Partnership regarding their EVV systems and how to integrate with the state EVV systems or what their plans are. Like I said, we're going to be working through this process between April 1st and the July 1st mandatory cutover, including tons more town halls and trainings from both us and your fiscal intermediary. So that's ongoing, and that will be coming up more. Right now, we're just working through the process of getting their systems connected to our system. I want to go over a couple of more questions because I haven't just been talking at the town halls. I've done Facebook Live meetings. I've done association meetings. I'm a member of the Georgia Council on Developmental Disabilities. I have a lot of people. I've been doing this work in Medicaid for 23 years. So I get people just who stop me at the grocery store sometime and want to talk about Medicaid. It happens more frequently than I would actually like, but that's all right. I don't mind. It's part of the gig, right? So I've answered a lot of different questions associated with participant direction. So one of the questions that I've gotten over and over again is, you know, we've heard that you have to do facial recognition. We don't want to do facial recognition. And this is a specific concern related to Acumen and DCI. So they do have, and I have talked to Acumen and DCI about this, they do have a facial recognition. It's not required. It's just an option for EVV systems. So all of our services require a sign out at the end of the service visit. Regardless of what waiver you're in, you have a sign out at the end of the service. We understand that not everybody can sign out for themselves. We also understand that family members might not be there all the time. Let's take the flip of the circumstance I talked about earlier. Maybe you're picking up the family member or the person you're the representative for is being picked up at your house, and at the end of the worker's shift, they're dropping them off at the day center, right? And they're for whatever reason, that person in whatever waiver isn't really capable of signing out for themselves. The systems, including the DCI system, has the capacity to put an exception and say that says member can't sign for themselves or member can't sign out for themselves, and that will not stop that individual claim from being processed. Now, I will say this, like with everything with EVV, it was built largely based on fraud, waste, and abuse. Again, that's not been our focus here in Georgia with it, although it is why the federal government mandated it. So if every single time you have to sign out, there's not a representative to sign out there, every single time, every single day of the week, that is going to come out on an exception report where we're going to say, I wonder why this member is always, and there may be always incapable of signing out, and there's never an authorized representative there to sign out for them. It may be completely valid, the reason why, but it will kick out on a reception report, and we are likely to question why that is. The next one is, am I being tracked? Again, no, we are not tracking you. There is geolocation at the time of clock in and clock out only. Some more questions. Is DCH providing or paying for equipment? No. DCH is not providing equipment, and Medicaid really is not allowed to purchase the devices for individual members for EVV because it doesn't meet the requirements of what's in the waiver in order to be purchased. So again, there is an exception criteria if your aide does not have a phone. So we would, look for you to apply for that exception criteria if they don't have a phone. The next one I already went over about not being able to sign. Again, there is a way to override that. Okay, so let's talk about some upcoming town halls. Like I said, because I've gotten a lot of questions about, hey, these seem to be provider oriented and I don't understand why we're on the call. I don't understand why we're doing the town hall. And that's largely my fault, because I wanted to make darn sure that every participant-directed and self-directed member had access to every single thing we were doing during EVV. I've heard for a lot of years about us not being open and communicating, so I wanted to make sure we were communicating everything. And then it may have been over-communicating, to be honest with you, because I got a lot of concerns about, you're asking me to be in something that really isn't for me. I don't need the provider administrative portal. So I would tell you that provider registration on 331 and 41 would be appropriate for your fiscal intermediaries, but probably not appropriate for you to attend. You're welcome to attend it. Please do, and get the information. Sorry, I had a little tickle in my throat. Had to stop and drink some water. You are welcome to go ahead and register. And again, those town halls will be available on our website, so you can also listen at your leisure. I would also tell you for the May, June, July, and August town halls to keep yourself advised of those. We'll be doing the email notifications like we have been for all of these. We'll be posting them on the DCH website as well. But we're keeping all of those topics open right now, because we really want to focus on what folks need, whether it be providers or members. We want to know what you guys need. So there very well may be one of these town halls that come up in May, June, July, or August that is focused very broadly on participant direction or fiscal intermediary. We do plan on having other non-monthly town hall meetings with the participant-directed and consumer-directed providers, in addition to these upcoming town hall meetings. Okay. That was quicker than I thought it was, 32 minutes. And even with the animation slide stuff going on. So that's pretty good. Close. I'm going to pause now. I can see if I can pull up the Q&A. Let me do that. Ooh, I can pull up the Q&A, but I don't know if I can. Okay, I can. This is good. I can see the Q&A.
Okay, well, let me know if you need me because I have it up.
Okay, thank you. Just make sure I didn't miss anything. No sound. I think people could hear me, so yep, okay, got sound. So that's a good one. Are you going to email us this information? So all of the information, including this presentation, is available on our website. You can get it there. We'll have these up early next week or at the end of this week. You can also download it. You can keep it. You can print it. You can do whatever you want with it. So they're available for you. Where is provider training taking place? It's taking place virtually. There will be this slides. All the slides are available, as well as the audio for this presentation. So those are available on our website. And guys, if you haven't looked at the old ones, go back and look at those too. They're out there. You can go back and listen to all the old presentations. You can even listen to the same presentation on multiple days so you can get the questions, because the questions are often very different. There's a question here that says, you call TELUS and they tell me they aren't ready to integrate yet. They tell me to reach out to them next month. So as a participant or a member, there's really no need for you to call TELUS about integration as a self-directed or participant-directed member. We're working with the fiscal intermediaries to integrate with them, so you don't need to do this. If this is a traditional provider who is on this meeting, please send me this information to the chat box. I mean, to the, not chat box, The email box you see on your screen right now, evv.medicaid@dch.ga.gov, and I will get with TELUS to address your concern. So if it is a traditional provider, please do that. If you forgot to log in and log out when they leave, there will be the ability within the system to go back and correct that. I've told this story on many town halls that I used to work at a record store as a kid. For those of you who grew up around here, I worked at Coconuts and Peaches and Tape World and Record Town. They were all the same company, right? And I was the worst about clocking in and clocking out. So bad that I eventually had to be written up about it, because I would get into the record store and start working. And then I would go, oh, dang it, I forgot to clock in. And eventually they had to write me up. So there will be a way to correct that. But again, like anything else, if you're having to correct every single clock in and clock out, we're going to have questions about that. Is an iPad a fixed device or considered like a cell phone where we can download the app? I believe you can download the app to an iPad, but I know the answer to this. You can download the app to an iPad, but you cannot download it to a laptop or like your fixed computer. Next question is about hearing. Can't hear anything. How do you handle multiple services on one visit? You clock in and clock out. So and if it's multiple staff members, you clock them both in and clock them both out. But and if it's one service or another service, like let's say you're doing extended versus basic, you're going to have that listed on your schedule. Your schedule is going to say, I have X number of hours of basic and X number of hours of extended. And that tracks to hours on your prior authorization, which is on your plan of care. And you will clock in for one service and clock out for the other service. Hold on, I gotta, y'all are asking new questions and it's messing up my thing. Got some folks who can't hear. Services, visits. Yes, the service is Android enabled. There's a desktop option for Acumen that is for the administrative portal, but it is not for clocking in and clocking out. Provider, so you're the employer. There's a question here about just definitions, like what is meant by provider. I am the employer for my daughter. So I get that. So for our purposes, the provider is really going to be the FI, and you're going to be like the administrator, just like you are now of the participant directed services. What is the approval process with the landline approval, and who will need to gain this approval, Acumen or DCI or both? Will the form need to be sent for both? Okay, we're approving it. So let me be clear. The Department of Community Health is approving the exceptions, not your fiscal intermediary. We are the ones who are approving exceptions. And we will need you to attest to the fact we won't be approving it for convenience. So we will need to know that your provider, your aides do not have a cell phone capacity to download the app and to use the app. So the options are for an app on your phone or the iPad, the telephonic IVR, which is the hard line in your home, and a fixed device. Those are the options. There isn't a computer option. This is a great question. All the questions have been great, but this is a really good question. Are there videos, how-to videos? You better believe it. So there are multiple ways that we are training individuals on what EVV is. We have live webinars, and you can see all this on our EVV website. We have written documents that are just like provider documents and policy documents. We also have instructional videos. I think there's over 40 of them. I can't remember how many of them I watched. And they're really good because they're short and very specific to the point. And they walk you through what it is. And if you're like me and you don't have the best attention span, those short videos are really good. Okay, so there's a flip phone can be used with the EVV system. It has to be a smartphone. It has to be able to download the app. So again, as far as what trainings you need to attend, that's up to you. You can attend all of them. You can just attend the ones that are targeted to participant directed. That is up to you. I'm not mandating what ones you see and which ones you don't see. When I use the term provider, yeah, I think I already answered that. What happens if someone lost or broke their phone and we still need them to work? Then you can apply for the exception if they don't have a phone. So yeah, if you're going to use the application, the next question is just wanting clarification that the application works on a smartphone or an iPad, even if it's an old smartphone, and that is correct. So about using, the next question is a great question. I've had it multiple times. Will we have the opportunity to use the same EVV system from the fiscal agent for other services like community access individual? So my understanding for that is yes, but like I said, we will have bi-weekly meetings with all the fiscal intermediaries, and we'll make sure that that is verified with the members that they serve. Is the app on the worker's phone or the participant's phone? It generally, we would think that would be on the worker's phone, but as long as you're using the app and the participant and the worker is signing in and signing out, physically there when they are, so that they can attest to signing in and signing out, that worker will have to put in their identifying information. So they have a username and password. That's not really, we could go either way with that and allow either way. But the expectation is that worker is only signing in for themselves, and they're only signing in when they start services with the member. And that's really important, because in auditing, that's something that our units and the federal government is going to be looking for. When I use the term fiscal intermediaries, I absolutely positively are meaning your fiscal intermediary, Acumen or Continuum. Sorry, I'm forgetting the third. They're going to be so mad at me because I'm forgetting. But I'm talking about. Thank you. Mm-hmm. Woo, I'm glad I have lifelines, y'all. The next question is, if you're with Acumen and a parent employee and put time in a laptop, no, not for EVV. Again, I think I've answered this a couple of times, but the way that EVV is able to be captured is via the app, or and this is for CLS or PSS only. And then as far as if you don't have that, we will have an exception criteria for you to be able to use a landline or to be able to use a fixed device. I've answered that one. Okay, you can still clock in and clock out, even if there's trouble with connectivity or whatever on the app. There's still no problem with you clocking in and clocking out, and when there is connectivity, it will connect to the TELUS system. I've answered that one. Hold on, I'm just going through and making sure I've answered everything. There's a question that what if I have an employee that comes in the morning and then they leave in the evening? And then they leave and come back in the evening. You would just clock in and clock out, clock back in and clock back out. Again, several of y'all have asked about no cell phone network at the patient's home. That doesn't matter. That's irrelevant. We can still capture where your location is, whether or not there's a cell phone network there. So just to be clear, that is not a hindrance and not a reason for an exception. And that includes, you know, if they have internet, they have a phone, but they don't have internet capacity. We'll probably verify that with the workers and really see what's going on in those instances if you request an exception. But you can include that in an exception, and we'll do follow-up on those. Yeah, both ourselves and the fiscal intermediaries will be doing additional trainings. Yes, in order to continue to be compliant with the 21st Century Cures Act and EVV for participant direction, you will have to be compliant with EVV, which means check in and check out on one of the approved methods. So that is true. I've been asked that question 3 or 4 times here in chat, and I think that's being a revelation for some folks. But like I said in the presentation, we're not going to be using the paper timesheets for this because it's not compliant with the federal rule. All of the training videos are on our website. All of the materials are on our website. And there are links to the TELUS website that go over all of the different videos. So if you need me to send you an individual link, I'm happy to do that. Just send that here at this EVV EVV email address. Just shoot that to me and I'll shoot you back an individual link that'll make it easier for you to get to, okay? We've put all the websites in there. I'm just going through and making sure there's nothing I've missed that hasn't already been asked. Yes, if you go out and leave in the morning and come back, you clock in each time you leave and each time you come back. Just like when I worked in a record store, sometimes I had split shifts and I would do that as well. Hold on 1 second, guys. Just want to make sure there's nothing I missed that I haven't already asked. No, the location you clock in does not have to be the same place you clocked out. If you are ICWP is, yes, absolutely subject to EVV for personal support services only. So there's a list of authorized representatives that can clock out and do the signature, and we take that from you. Okay, I think the rest of the questions are repeats. And there's some things on here that I've addressed and is in all of our presentations, like community access group is not part of EVV. So I'm going to really advise you to go back and look at the information that is on our website. There is multiple information available on our website. I don't think any question that I've been asked isn't in our frequently asked questions or hasn't been already previously addressed. But in the event that if you're like me, and sometimes you like for individual questions to be answered so you have it on your own record, you can do that as well. Again, use this EVV mailbox and individually send me the question, and I will individually send you an answer back. So you have it in writing and you can keep it. So if you don't feel like your question was answered, please utilize evv.medicaid@dch.ga.gov. And even if I answered it on today's email, on today's presentation, and you just want your own specific answer, I'm willing to do that too. That's no problem. So go ahead and send it to me again individually so you can get a written response back. Okay? I want to thank everybody for their time and participation today. I want to thank TELUS and DVHDD for being my lifelines. We'll get that presentation thing fixed where it was automatically going forward for the next presentation. And I hope you all have a great night. Thank you.